Assalamu alaikum guys. Today we are talking about the low back pain. Low back pain is an extremely prevalent problem with up to 85% of the people experiencing low back pain at some time during their lives. Low back pain is second rinsing low back pain at is second only to the common cold is causing absence from the workplace, and back injuries are the most frequent and most expensive of all workers compensation claim in the United States. Moreover, the incidence of low back pain in the United States have been steadily increasing for more than the past decade, like a direct result of increasing incidence of overweight and obesity, which is significantly associated with the low back pain in the both men and women and at all ages. Most back injuries also involve the lumbar or low back regions. Although the psychological and social components are a factor in some low back pain cases, mechanical stress typically plays a significant causal role in the development of low back pain. Perhaps because of their predominance in the occupations involving the handling of heavy materials. Men under the age of 50 experience low back pain about 4 times more frequently than do women. The low back pain is relatively common in the children. This incidence increases with the age, with approximately 18% of the children having experienced low back pain by the age 14 to 16. Both children who are inactive and children who are extremely active in sports are more likely to experience low back pain. Most cases are musculoskeletally based and self-limiting. Low back pain in the adolescent is associated with low back pain recurrence in adulthood. Not surprisingly, the athletes have a much higher incidence of low back pain than do non-athletes, with over 9% of the college athlete in the different sport receiving treatment for low back pain. Participation by the children and adolescents in the scorer basketball, lacrosse, baseball, tennis, and football has been associated with increased risk of low back pain. Loading patterns that injure the biological tissue may involve one or few repetitions of a large load or numerous repetitions of a small load. Repeated loads such as that which occur in the industrial work, in exercise performance, and in jobs such as truck driving that involve vibration can all produce the low back pain. Although bone structures, intervertebral disc, and ligaments are contribute to the spinal stability, it is surrounding muscles that have been shown to be primary contributions to spinal stability. In particular, coactivation of the spinal agonist and antagonist serves to increase the stiffness of the motion segments and enhance the spinal stability. MC Gill advocate training the trunk muscles for endurance rather than for strength as a prophylactic for low back injury. Although the injuries are some known pathologies may cause low back pain, 60% of low back pain is idiopathic or of unknown origin. This risk factor for the chronic disabilities due to the low back pain include the involvement of spinal nerve roots, substantial functional disability, widespread pain, and previous injury with an extended absence from work. However, most low back pain is self-limiting, with 75% of the cases resolving within the 3 weeks and recovery rate of 90% within the 2 months, whether treatment occurs or not. Thank you so much for watching.